Hi friends, let's go through the community medicine questions which came in NEET exam which was conducted on September 11, 2021. A lot of community medicine questions came and when I asked students they said it was easy, question was easy, like no complicated questions were there from community medicine, but answers were really confusing. Okay, so it was very confusing to pick which is the most appropriate answer. So such questions were there and these questions are based on the recall from you guys only, so it may not be completely correct, and if you have any disparity, if you find any disparity from your own recollection, you can let me know at the end. Okay, so let's go through the questions. First one, you were given in charge of health service in a nearby school in rural area. To whom should you provide report or give information on school health services? This question was there, right? Said to PHC, sub-center, district hospital, sub-divisional health center. Okay, so the question is about the latest school health program. You know, the latest school health program was introduced in 2018 under AIIMS Bharat. And under AIIMS Bharat, we have certain new schemes introduced. We have health and wellness ambassadors. Who are they? No one but teachers. Okay, so teachers in the school should act as health and wellness ambassadors. Every week they will take health and wellness class to the students. Is it clear? And children thereafter will act as, I am going to introduce the next term, health and wellness messengers in the society. That means from teachers to students and students to the society. So, they will act as messengers. They will go to their houses and they will go to their neighborhood and they will teach the rest about the health and wellness. So, students will act as messengers, health and wellness messengers. So, I have introduced two terms, health and wellness ambassadors who are teachers and health and wellness messengers who are students. And every week, one day there will be a class, and that day is, that is health and wellness day in school is Tuesday. That is the next MCQ. So, since they have started with school health program in the last exam, so we can expect further questions from this topic in the coming exams. Okay. Now, let us see what are the services given under school health program. So, we have already seen that promotion activities like promotion of healthy behavior and prevention of diseases delivered through teachers and students. Then health screening activities in connection with Rashtriya Bala Swasthya Karyakram, that means RBSK, where you are screening 30 diseases, 4 Ds prevalent in children. So, we have health screening as well. First is promotion activities, health promotion activities through wellness ambassadors, then health screening through RBSK, then provision of few other services like iron folic acid, we are giving every week, right? Then albendazole given every 6 months through teachers. Then for adolescent girls, sanitary napkins are provided. And the name of that sanitary napkin is, that is the next question, free days. Okay. And age appropriate vaccination is also given. So, these are the services, health services that are given. And then we are also keeping electronic health records. I do not think you will get a question from that. And teachers are given, or teachers are training first aid in children. Okay. So, these are the services. Next. All the services are divided as weekly, fortnightly, quarterly and biannual. We have already seen, but what are the ones, which are the ones given weekly? One is wellness class and iron folic acid. Don't you know that? Given every week. Fortnightly, they have thematic school assembly. Fortnightly means once in every 2 weeks or sometimes once in every month. They have thematic school assembly, one day nutrition will be the theme, next day reproduction will be the theme. So, likewise they will keep different themes, and question box responses. Then quarterly, that means every 3 months, they have a thematic adolescent health day, okay, and parent teachers meeting. And biannual, that we have already seen. Biannual means once in every 6 months, we are giving albendazole to children, 400 mg, right, which I think 400 mg for national deworming. By the way, when is National Deworming Day? It is February 10th. So, let us see all the MCQs in connection with this topic. February 10th is National Deworming Day. Now, let us see what are the other programs which are associated with school health program. So, we have combined few other programs along with school health program. One is Fit India Movement, Eat Right campaign. All these are in association with health only. Poshan Abhiyan, again, you know, Poshan, matlab nutrition. So, this is a campaign for eliminating malnutrition. Rashtriya Kishore Swasthya Karyakram. Kishore means adolescent. So, this is a health, Swasthya means health. So, this is a health program for adolescent, and Rashtriya Bal Swasthya Karyakram. Bal means children. So, for children, and we have program for adolescent. All these are combined into school health program, and in schools through these programs we are providing a lot of health promotion activities. Okay. Now, coming to the question that we started off. PHCs in India are charged with the responsibility of administering school health services. Okay. And medical officer of PHC is supposed to cover 5,000 to 6,000 children a year. So, what is the answer for this question? It is PHC. So, school health program is initiated or given through primary health centers. So, the answer is PHC. There was a lot of confusion. Few said it is district hospital, few said it is sub-center. No, the answer is PHC. Hope you are with me, and we have seen all the questions associated with school health program. Moving on to next. This was very easy. I don't think anybody would have got this wrong. A patient is on ATT, antitubercular treatment or therapy. She is using OCP as a contraceptive. Which of the following can cause contraceptive failure if using OCP? Beyond doubt, everybody know the answer. It is rifampicin, right? Now, what is the mechanism of action? As you all know, rifampicin can induce cytochrome P450 group of hepatic microsomal enzymes, and these will initiate the metabolism of estrogen and progesterone in OCP. So, that leads to failure of OCP, and this is the only antibiotic and oral contraceptive interaction that has been proven so far. Some say even INH has a role in decreasing the bioavailability of OCP, but that is not yet proven. But rifampicin, it is proved. So, the answer is rifampicin. Next question. A girl with history of respiratory infection and yeast infection since 3 months of age, now assessing her immune status, which vaccine is contraindicated? See, a girl, she is getting recurrent respiratory and yeast infection. Yeast is usually an opportunistic infection, right? So, if she is repeatedly getting an opportunistic infection, that means there is something wrong with her immune status. So, we should consider that this girl would be immunocompromised. So, the question is, among the following vaccines, among the 4 options, which one do you think, or which one will be contraindicated, or which one will you reconsider when you are giving vaccination? Which one? See, live vaccines cannot be given in a immunocompromised person, right? So, the question is, which among this is a live vaccine? What about TT? Tetanus toxoid, it is a toxoid vaccine. What about DPT? D and T are toxoid, whereas P is killed vaccine. IPV, you already know it is killed only. This is also killed, whereas MMR is a live attenuated vaccine. So, in a immunocompromise, we should be very careful when you are giving a live attenuated vaccine. So, MMR should not be given in a immunocompromised person. That is a point, which again I think you would have got it correct. A farmer whose predominant diet is maize has presented with the following skin lesion. What history will you ask in this patient? So, this was the picture that you got for your exam, and actually I couldn't recollect all the options, but I could recollect, I could get the correct option for this question. So, I have just put the correct answer here. I don't know, there is a confusion regarding what was B, C and D. So, I just put the correct answer here, diarrhea and dementia. By the way, what is the question? So, you are given a image, and this is the image of a farmer who is on maize diet, and what history will you ask to this patient is a question. It is not the diagnosis, what history. So, my first question is, what is the diagnosis? This is Cassell's necklace, right? What you see here is hyperpigmentation around the neck, which is Cassell's necklace, right? And Cassell's necklace is seen in Pellagra. And Pellagra is associated with, it is deficiency of vitamin B3 or niacin, right? It is due to the deficiency of niacin. And niacin is, or niacin deficiency or pellagra is usually seen in people who are eating maize or corn. Okay. So, what history will you ask in this patient is the question. Okay. So, in a pellagra patient, the question is, what are the manifestations that you see in pellagra? As you all know, it is 4 Ds, right? Which are those Ds? There will be diarrhea, dementia. What you see here is dermatitis. Okay, sort of dermatitis, I would say, photosensitive dermatitis. And the 4th D is death, which is also not rare in pellagra patient if untreated. So, if you see this, you should also ask them, do you have diarrhea? Do you have, loss of memory? Do you have dementia? So, such things you need to ask the patient. Okay, so here the answer is diarrhea and dementia because of 4 Ds. Okay. Now, let us see few more MCQs. So, this is pellagra, it is due to deficiency of niacin or tryptophan, which is a, amino acid. This is vitamin D3, right. So, you can even get deficiency of vitamin D3 in the option, or niacin or tryptophan. And the 4 Ds are diarrhea. This is the clinical features: diarrhea, dermatitis, dementia, and possibly even death. 4 Ds. We have 2 types of pellagra. Now, let us see the details. You have primary pellagra and the next has to be secondary pellagra. Primary pellagra is mainly due to the diet. That means, if your diet do not contain adequate quantity of niacin or tryptophan, then you can get primary pellagra. It is due to diet, or I would say insufficient diet, or if your diet does not have sufficient quantity of vitamin D3 and tryptophan. Next MCQ, which are the food that are associated with pellagra? One is maize and the second is corn. So, both these I have seen in exam. Corn eating person or a person who is predominantly on maize diet. So, both these you can expect in your MCQ. By the way, what is the problem with maize? In maize, niacin or tryptophan is less in quantity. Moreover, whatever is less, that will not be bioavailable to your body. Okay, first of all, sufficient, you do not have it. That means the quantity is not adequate and the bioavailability is also less. So, what you do is, there is a process known as nixtamalization. So, what is nixtamalization? What you need to do is, the maize or corn is treated with alkali, especially lime. Okay. And when you treat it with lime, the niacin will be bioavailable, and it is said that if you are predominantly on maize diet, you do nixtamalization and then there will not be pellagra. That means, pellagra will not manifest. That means, you will get adequate amount of vitamin D3. Okay. So, nixtamalization, I do not know whether you are familiar with this, but get familiarized with this, because as you all know, for this particular exam, I think around 2 or 3 questions came from the same vitamin B3 deficiency. So, I think this is a favorite area from which you can expect further questions. And what is secondary pellagra? That is secondary to so many other reasons. Primary is due to food and secondary due to so many other conditions which can actually cause or which can actually lead to malabsorption of vitamin B3, like gastrointestinal diseases, chronic alcoholism, weight loss or bariatric surgery. Again, there will be malabsorption. Of course, that is the intention of doing a bariatric surgery, but the side effect are adequate nutrition also will be delayed. Then anorexia and some medicines, like these are important: isoniazid, 5-fluorouracil, 6-mercaptopurine, pyrazinamide. Pyrazinamide was a previous MCQ. Then INH also was a previous MCQ. Then ethionamide, phenobarbital, please go through all this. Azathioprine, chloramphenicol, all these can lead to secondary pellagra. So, see, these are the drugs which can lead to secondary pellagra. And how do you do the diagnosis? It is typically based on the symptoms, of course, and may be assisted by urine testing. Symptoms and urine testing will help you to do the diagnosis. Okay. Moving on to the next. Again, image-based question. A girl presented with dryness of eye and her elbows are showing lesion as you see in this image. What is this condition? Very simple question. Condition is phrinoderma. Beyond doubt, this is phrinoderma, which is follicular hyperkeratosis. Now, let us see the MCQs. Okay. This is follicular hyperkeratosis. It is a form of follicular hyperkeratosis which is associated with nutritional deficiency. A lot of questions from nutrition this time. Now, which all nutrition? Lack of vegetable, fruits and fat in diet. Then, vitamin A deficiency is the most common reason, vitamin A deficiency. And the second is essential fatty acid deficiency can also lead to phrinoderma. Then severe malnutrition, vitamin E and vitamin B deficiency. So, the most commonly seen is vitamin A deficiency followed by essential fatty acid deficiency. Okay. Here also other causes like we have seen in Pellagra, intestinal malabsorption, then alcoholism, almost same, anorexia nervosa, fad diets. What are fad diets? Fad diets means certain popular diets doesn't have much of a logical thinking, like keto diet, vegan diet. They are very popular, people just follow it, religiously they follow it, but those may not be scientific all the time. So, such diets which are very prevalent nowadays can lead to malabsorption. Then previous bariatric surgery and pancreatic insufficiency, inflammatory bowel syndrome, gallbladder disease, all these can lead to hyperkeratosis. Now, the management is mainly nutritional, mainly. So, vitamin A replacement, that is one answer. Then vitamin A rich food like liver, carrot, spinach, egg yolk, all these have high amount of vitamin A. Then essential fatty acid, supplementary linoleic acid using safflower or linseed. You can take it 2 tablespoons twice daily, and since it is hyperkeratosis, that won't go unless you give some topical agents like topical keratolytic agents, salicylic acid ointment or tretinoin gel. So, that will if there is hyperkeratosis, that will be taken care of if you put some keratolytic agents, urea cream, etc. Okay. So, all these should be there in your mind from hyperkeratosis or phrinoderma. Question number 6 is, in Kerala floods, the tab doxycycline is distributed for prophylaxis along with. So, here the question is about flood, and why Kerala? Because as you know, Kerala is encountering a lot of flood in the recent past. And what is the relationship between flood and doxycycline? In the post flood situation, a disease which is very commonly seen is leptospirosis. And for preventing leptospirosis, the drug of choice is doxycycline. Next MCQ, what is the schedule? It is doxy 200 milligram every week, that means weekly once, every week for a maximum of 6 weeks is what the guidelines say. That means as long as the person is exposed to flood water, he is supposed to take weekly once dose of 200 mg doxycycline. Is that clear? So, that will help in preventing leptospirosis. Okay. Now, how do you get leptospirosis? By the way, what is the reason behind, what is the mechanism behind getting, or what is the reason for getting leptospirosis? When the body or open wound comes in contact with water which is contaminated with rat urine. You know that, right? That is how the organism is getting inside the body. So, here the major culprit is a rat, right? If no rat, no leptospirosis. So, for killing rats or to destroy the rats, along with this, when there is a flood, the government is also distributing a rodenticide. So, which among this is a rodenticide? That is zinc phosphide. Okay. So, flood means doxy and zinc phosphide. Okay. Now, let us see how this zinc phosphide is given. So, we have locally made zinc phosphide like you see here, and the hi-fi company made branded ones like Moteen, all of them have this zinc phosphide. And let's see the MCQs from zinc phosphide. It is a rodenticide. When mixed with water or when it becomes moist, it gives out phosphine. This has got a garlic odor that will attract the rats. And how do you keep it as a bait? Used in the ratio of 1 part to 10 part of wheat or rice flour. You need to attract rats, so you mix it with something which is very edible for them, like wheat or rice flour, and mix with a few drops of edible oil for attracting rats, and these are kept in the bait boxes. And while handling, always use rubber gloves, and this kills rat in 3 hours. So, that is zinc phosphide. Hope you are with me. Moving on to the next question, question number 7. A 16-month-old child weighing 8 kg in WHO weight for age chart, the child is below -2 standard deviation. What is the diagnosis and management? Weight for age chart. What is it? Growth chart. So, here the question is regarding growth chart. Now, let us see the MCQs from growth chart. Here it is said that the child is shown to be less than -2 standard deviation. What is it? Let us see. Age is 16 months. Weight is 8 kg. So, all these should be kept in your mind when you are writing the answer. First MCQ. The growth chart is also known as mother and child protection card. May you know why? Because this card contains, what you see here is the MCP card. Okay, MCP card, mother and child protection card. Because this also contains a lot of information which are very beneficial for the mother and child. So, this is not only for plotting the age and weight of the child, but also contain, as you can see here, a lot of other information which will help the mother and child. So, that is why it is known as mother and child protection card. Okay. Second point, we have 2 MCP cards, one for girl which is pink in color, and the second one for boys which is blue in color. That also I am showing you. Okay. Next one. These are, it's a chart actually, that means it has got an x-axis and a y-axis. Along the y-axis you plot weight, and along the x-axis you plot age in months, because every month the child is supposed to come to Anganwadi. I hope you know that. This is usually done under ICDS through Anganwadi. So, every month the child is supposed to come to Anganwadi, and the Anganwadi teacher is supposed to weigh the child and plot the growth chart. Okay. So, along the x-axis you have the weight of the child, and along the x-axis you have the age of the child, along the y-axis you have the weight. Okay. If I get confused, you can look at this. Okay. This is weight, along the y-axis, and along the x-axis you have the age, right. Next, how many colors you see here? There are mainly 3 curves, right. You have a green curve, you have a yellow curve, and you have a orange curve. And after plotting, if the child weight is, or that point is falling, I will tell you how to, I will really show you how to do this, but just understand that if the child is coming in the green zone, that means normal nutrition, that means adequate nutrition, adequate nutrition. If the child is coming in yellow zone, that means there is moderate malnutrition, moderate malnutrition. And if the child is coming in red, red is always danger, that means it is very, very danger, that means the child is severely malnourished, severely malnourished. So, you have normal nutrition, moderate malnutrition, and severe malnutrition. That is why we have 3 different colors, and that applies for boys as well as girls. Okay. Next MCQ. See, normal means we have seen in statistics in a normal curve. I have told you normal means mean plus 2 standard deviation minus 2 standard deviation. Just try to recollect from my class. Normal means it will fall within normal, will fall within plus 2 minus 2 standard deviation, right, or mean plus or minus, I will write it like that, mean plus or minus 2 standard deviation. That means mean plus 2 standard deviation minus 2 standard deviation contain 95% of values in your data set, and I have told you that is considered as normal. That means anything up to minus 2 standard deviation is normal. So, anything beyond minus 2 standard deviation will be considered as abnormal, right. So, the point that I want to tell you is, up the last part of this green zone, let me take another color so that it is easy for you to, okay. See, up to here is taken as -2 standard deviation, because up to -2 standard deviation is normal. So, this yellow is nothing but it is less than -2 standard deviation, and usually see 5% will be falling outside, and I have told you out of that 2.5% will be less than -2 standard deviation, right. So, below this around 2.5% of children would be falling, okay, which is abnormal only. And the green is even beyond that, which is considered as -3 standard deviation. Are you with me? If you don't recollect about the normal curve, just to understand that yellow is -2 standard deviation, less than -2 standard deviation, not -2, less than -2 standard deviation, and red is less than -3 standard deviation. That much you can remember, right? Okay. Now, do not think what it is. If you have read that normal curve, then you will understand this. Anyway, less than 1% of children will fall, are likely to fall under, or less than 0.5% of children are likely to fall under -3 standard deviation. That is very, very less in weight or nutrition, very, very less. Are you with me? Green is normal, yellow is less than -2 standard deviation, and red is less than -3 standard deviation. Okay. Now, let us see, all these are MCQs by the way. Now, let us see how to plot a growth chart. I think you know it, because during your UG time you might have done it on your own. Now, I will show you how to plot growth chart. You might be knowing it already from your UG time. Okay. So, this is a growth chart. Here the child is, the age of the child is 5.5 months, around 5.5 months. So, first you ask the mother what is the age, then you mark it. Okay. Then you take the weight of the baby, and here the weight I think is around 5.8 kg. So, this is 5.8 kg. Then you see which is the point where both these are coinciding, and that is taken as the point where you should be plotting the growth chart corresponding to that age. And what is your interpretation? This is like normal. Now, another baby of same age, but the weight was found to be less than 5. So, what happened? That means moderate malnutrition. Are you with me? So, this is how you plot the growth chart. Okay. Next, based on the growth chart, you are supposed to give advice. Suppose the mother is coming in the green zone, not mother, sorry, the baby is coming in the green zone. That means adequate nutrition is there. So, just tell the mother that they have to continue the same nutrition. Okay. If the baby is coming in the yellow zone, that means there is moderate malnutrition. So, they ask them to give more of nutritional supplements. And what if the baby is severely malnourished? That means the baby is coming in the red zone. That means it is danger, right? So, such children who are coming in the red zone should be hospitalized. And for that we have nutritional rehabilitation centers, where the child will be admitted and the nutrition will be taken care of by giving parenteral nutrition and so many things which we have discussed in the chapter nutrition. So, just go back and refer to that. Okay. So, green means no problem, the child can continue the same nutrition. Moderate or yellow means need better nutrition. So, you have to give nutritional advice regarding which are the other food that should be given. You have to ask them to give high calorie diet, high protein diet, and you have to explain them. Okay. And if green, hospitalization or institutional management is the term. Okay. Good. Now, how do you track the growth? That we have already seen. Now, here you see 3 different children of the same age. Okay. This is the first child, and child 1 is having adequate nutrition, that means normal. The second child is malnourished. It is coming under moderate malnutrition. Moderate malnutrition means low weight for height or acute malnutrition. So, what happens? The child becomes wasted like this. Okay, that means height is normal but weight is less. This is acute malnutrition. Whereas, look at the third child. The third child, from the very beginning itself, he is in the severe malnutrition track. So, what happens? It is chronic malnutrition, and chronic malnutrition will result in stunting. So, this is stunting seen in chronic malnutrition, where the height for age is less. So, here in this particular picture, I have included many MCQs. First one, what is acute malnutrition? This is acute malnutrition. Acute malnutrition means low weight for height. Low weight for height. That means height is alright, but weight is reduced. See, look at this. Height is okay, but weight is reduced. And you also call it as wasting. That is the next MCQ. It is also known as wasting. Third is chronic malnutrition, which will also affect height of the child. So, it is known as stunting. It leads to stunting. Okay. Now, how do you plot height and weight, and what is the frequency in which it should be done ideally? Many won't do it ideally, but I am telling you what is the ideal follow-up for growth chart. Every month from birth till 3 years, you have to weigh the baby. Okay. And what about the length? Length once in 3 months. Up to 3 years, weight. And up to every 3 months, up to 2 years, you take the length of the baby, and after that the child can stand straight, right? Then you can use a stadiometer, and once in 6 months, from 2 years till 5 years, you are supposed to take the height. This is how you assess the nutrition of baby or child. Okay. So, here the answer is child is below -2 standard deviation. That means the child is moderately malnourished, and moderately malnourished mother should be advised to improve the nutrition. If severe malnutrition, then send child to higher center. Okay, this is also an MCQ which you can expect. Okay, this is wrong. Severe malnutrition and counsel the mother for high calorie and nourishing diet. No, the child should be sent to NRC, that is Nutritional Rehabilitation Center. That is the answer. Question number 8. Global Hunger Index include all the following except. This question was there now? Yeah. Now, let us see what is Global Hunger Index. As you can guess, Global Hunger Index means, as the name indicates, this is a parameter which will help you to compare the grade of hunger in different countries. So, this is set at the global measure or global level to measure hunger and to compare hunger between different countries. Next MCQ, it is calculated by International Food Policy Research Institute. Next MCQ, it was initially calculated for 120 developing countries and countries in transition. That means developed countries are not included in this because they don't have hunger. Now, let us see what is the range for GHI. It ranges from 0 to 100. 0 means absolutely no hunger. Very good country. 100 means worse that you can expect. The next very important question is, which are the parameters using which you measure global hunger index? There are 4, which are like this. Percentage of undernourished population. What percentage of population is undernourished? And the next 3 are based on under 5 parameters. That means percentage of under 5 deaths, percentage of under 5 wasting, percentage of under 5 stunting. What is wasting and what is stunting has been explained in the previous slide. Okay, so you can think in terms of that. Wasting means low weight for height. Stunting means low height for age. Acute malnutrition and acute chronic malnutrition is what is said here, and this is under 5 death. Okay, or child mortality is under 5 death. So, percentage of undernourished population, under 5 death, under 5 acute malnutrition and chronic malnutrition. So, these are the 5 parameters using which we are constituting global hunger index. Now, let us see how to categorize them. Less than 10 means low hunger, the country does not have hunger at all. 10 to 20 or 19.9 to be very specific, moderate. 20 to 34.9, serious hunger. 35 to 49.9, alarming hunger, and beyond 50 is extremely alarming hunger. Now, we do not have anything beyond that. Okay, if that country is getting more than 50 means you do not have to look beyond, it is extremely alarming hunger. Okay. Now, are you not interested to know where are we exactly standing? India ranks 94 out of 107 countries in the year 2020 with a value of 27.2, which is coming under serious hunger. Okay, so our country is having serious hunger issues, and in the year 2020 our rank was 94. So, I thought I will start off with something good. So, we were above 100 at least in rank, but what happened in 2021? Maybe because of COVID, we do not know, our rank has come to above 10, above 100. Now, our rank is 101 and our score is 27.5. That means, from 27.2 it has increased to 27.5. So, our hunger level are again increasing. From 2020, we are compared to 2020, in 2021 the hunger level has gone up, and the current rank is 101. So sad. That is the condition of India right now. So, this value is important, this rank is also important. Okay. So, what is the answer here? It is IMR. IMR is not included in Global Hunger Index. It is under 5 mortality rate. Under 5 mortality, child mortality, under child nutrition, child undernourishment, all these are there, but infant mortality is not there. Next, SI unit 4, power or intensity or brightness. I exactly do not know which was the term that was used in that. Majority of students said it was intensity of light, and many others said it was brightness. 1 or 2 said they had asked for power, I do not know. I think it was intensity. Okay, intensity of light source considered as a radiating from a point, somewhat like this was the question. Okay. So, what is the international unit for intensity of light source or brightness? That is a question. And the answers are lux, candela, lumen and Lambert. This question is from chapter environment, that is light, a chapter which is usually ignored by everyone, but now you know this is important. Now, I will show you a table from Park textbook. So, they have very well explained in this table what are these parameters. So, let us see. I will start with the first two. The name of the quantity measure, description and recommended unit, like that they have given, and other units, but I would say you just ignore the other unit because other unit is really confusing. Just concentrate in the first 3 columns, that is which is the quantity measure, what is the description of that and what is the recommended unit. First two are luminous flux and luminous intensity. Now, what is luminous flux? Luminous flux means, please listen carefully, the light that is emitted from a source which is flowing in all directions is luminous flux. Okay, think about a bulb, the light that is emitted in all directions is luminous flux, and that is measured using the unit lumen. Whereas, luminous intensity, also known as brightness of light, is the light that is radiating in one direction only, Okay. Now, you may think, what is the main difference between, see, luminous flux is in all direction, in one direction is intensity, then how is it, why it is known as intensity? Because, see, you please do understand that the luminous flux is in all direction, whereas intensity is in one direction because the intensity can be changed. For example, if you are keeping a lens in one direction, what happens? The brightness as well as the intensity in that direction increases, right? Are you getting me? Look at this picture. This is luminous flux in all direction, whereas this is luminous intensity. Okay, that means in one direction. Here what happened? As I told you, someone has kept a lens in one direction. So, the intensity is getting concentrated there. That is why you call it as intensity, the light that is going in one direction. I hope you are with me. And it is measured using candela. And the next two are little more easy. Illuminance or illumination and luminescence. In your Park textbook, let me tell you, they have also written brightness here, but in no other standard books I could see luminance or brightness in any of the description. Okay. So, I would say that is why I have kept it in a different color, though it is included in Park textbooks. And luminance or brightness, just ignore this term brightness. Brightness means luminous intensity. So, this way you can always, intensity means brightness, because intensity can be increased by making the waves concentrated in one direction. So, that will increase the brightness. So, that way you can relate. Whereas, illumination or luminescence are two different things. Illumination or illuminescence, it is very difficult, right? Illuminance or illumination means amount of light which is reaching a surface, and what is reflected from there is the fourth one, luminance. Okay. So, amount of light reaching a surface is illumination, and the one that is directed from there or reflected from there reaching your eyes is the luminance. Okay. It all sounds the same, illuminance, luminance, but spelling is not the same. Okay. And illumination or illuminance is measured using lux, and the one that reaches your eyes reflected from the surface is Lambert. Okay. So, here the question was about intensity of light and the answer was candela. Now, I will show you one more picture. So, this is luminous flux. There is a projector, light is flowing in all direction and it is reaching the screen. So, what reaches the screen is illuminance or luminance, illuminance, and what the light that is reflected from there and reaching your eyes is luminance. Are you with me? Okay. So, that way you can remember all this. Answer is candela here. Question number 10. A farmer from Chhattisgarh is having complaints of skin rash which increases on sun exposure. So, what is it? Naturally, they are talking about photosensitive or photodermatitis. Okay. There is also redness of tongue. Maize is a staple food. Again, which of the following vitamin deficiency can cause this type of feature? So, which is the vitamin? It is vitamin D3. And what is vitamin D3? It is niacin. Okay. So, the question is vitamin. So, vitamin is niacin only, vitamin D3. Okay. So, this is nothing but something similar to, I think, question number 3 that we have discussed. Okay, Cassell's necklace, we have seen that. So, there the question was regarding the clinical features, and here again the same, maize as a staple food, but photodermatitis and the vitamin deficient is niacin. So, this is very important topic. Now, let us see few more MCQs. We have already seen about Pellagra. Now, here the question is about photodermatitis. So, let me go a little deep into the photodermatitis that you see in Pellagra. The first picture we have already seen. This is Cassell's necklace that you see in Pellagra. Those things I am not going to tell once again. This is Cassell's necklace. See, very nice, like a necklace. And photodermatitis is something that you see in Pellagra. And this is a normal photodermatitis that you see. Okay. But you know, in some cases, in certain patients, the photodermatitis will be so severe that there will be hyperpigmentation and keratolytic lesion covering the back of your hand as well as the sleeves like this. Okay, the wrist, back of the wrist, back of the hand, as you see in this picture, it will be black, hyperkeratotic with scaly lesions, and this appearance that you see in severe Pellagra, it's photodermatitis only, but this is not by a sign. Any idea? I want you to think. Actually, I had mentioned this in my class. If you had gone through those videos, you might be knowing the answer. What is it? Dash sign of Pellagra. What is it? This looks like what? The metallic glove that soldiers used to wear, right? No, what do you call this? That is a name given for that condition. This is gauntlet. Okay, gauntlet. So, this condition is known as gauntlet sign of Pellagra, which again you can expect as an MCQ. Because Pellagra is very important. In and out they are asking Pellagra. Okay, 3 questions were there for the last NEET, so you can expect many more in coming exams. Okay, moving on to question number 11. A 11-year-old child presented with fever and sore throat. To diagnose the condition, a throat swab was obtained and sent for culture. Okay, fine. After collection of the throat swab, the throat swab should be discarded in which color coded bag according to the biomedical waste management? Swab. It is contaminated waste. That goes to, beyond doubt, you would have written, I am sure you have written it correct, as yellow bag, because we have discussed this many times in QRP sessions, in normal class, in many places we have discussed this question. So, it is yellow bag. So, let us see once again how the biomedical waste management is done in the hospital. What we follow now is the latest guideline 2016. You may think it is old, but this is the latest one. Okay. According to that, we have how many colored categories? You have 4 colored categories, which are yellow, white, red and blue. Now, which all waste you put in yellow? All contaminated waste, almost everything. Okay. All contaminated waste which are dirty, you put in yellow. Okay. Like I always say, yellow, yellow, dirty fellow, right? So, all dirty things which you don't want to touch anymore, you put in yellow, like anatomical waste, soil waste. The other one was soil waste, right? Expired, discarded or cytotoxic drugs, chemical waste, microbiology, biotechnology, lab waste, everything you put in yellow. Okay, and as I told you, they are all dirty things which you don't want to touch. So, what you do is just take that bag and you incinerate it. That means you burn it even without any chemical disinfection, you incinerate it. So, what happens to this? This go for incineration. That is also an MCQ. Next is white. Though you say white, it is not actually white, but it is transparent or translucent, I would say, not transparent exactly. Okay. Now, the question is, what is the purpose of keeping a transparent bucket? You should be able to see what is inside, even from outside, right? So, what will be the type of waste that you put inside that? Sharp waste, which can be very dangerous. So, you will be able to see it from outside and you will not put your hand accidentally, and thereby you can prevent an injury. Okay. So, sharp waste like scalpels, needles, all this you put in white. Then what will you do with that? You disinfect it, and that will be taken to sharp pits. So, this goes to sharp pits. Most of the hospitals will have a sharp pit, and you put this in a sharp pit. Okay. Now, which all waste you put in red? Red, you can remember a term starting with R only. Okay, one more thing, let me tell you. See, whatever you put in red will be recycled. Recycle means you are using it repeatedly, right? So, you can remember RPT. What is the short form of repeat? In case sheets and all, right, repeat order, RPT, right? So, you remember RPT in association with red due to 2 reasons. One, it is starting with R, and second, that will be recycled. And why do you want to remember it as RPT? Because R, P and T are the things that you put in red. What is R? Rubber. All rubber items like Foley's catheter, plastic and tubes, you put in red. All rubber, plastic, tube, you put in red, like tubes, bottles, syringes, tubes, bottles, syringes, catheters, urine bags, all those will go into red. Gloves, I forgot to write, gloves, another frequently asked MCQ, gloves will go to. And what do you do with those things that you put in red, you disinfect them, then you pulverize it. That means you cut it into small pieces, and that is recycled. Recycled. See, recycle, I didn't say reuse. You won't reuse, it is recycled. That means that will be transformed into something else, like sometimes bags, sometimes roads. It can be made into something else. Okay, so that is recycled. And what type of waste you want to put in blue? In blue, you are putting broken glasses, metallic pieces and such things. Okay, after opening a vial or after opening a ampule, it is broken glass piece, right, that you put in blue. It's not sharp, it is, of course it is sharp, but broken glasses go to blue, whereas original sharp things like scalpels and needle will go to white. Okay. And what do you do with the things that you put in blue, these metals and glasses? What will you do with that? We can't use it, right? So what you do is, after disinfecting, that will be taken back to the manufacturer. You send it to metal factory or you send it to glass factory. They will do whatever is necessary from there. So send back to the manufacturers. Okay, so that is what you do. Hope you are with me. Okay, next MCQ. Where will you put pacemaker? This was question 2 years back. Pacemaker. Pacemaker is a metallic implant, so that goes to blue. Next, where will you put blood bag and where will you put urine bag? Another MCQ. There is an easy way to remember. What is the color of blood? That is red. What is the color of urine? That is yellow. But you are putting it in the bags other way around. That means red will go to yellow bag and yellow will go to red bag. That means you are putting urine bag in red and the blood bag in yellow. So opposite. It's not color wise, but just the opposite is the way you put or discard these bags, urine bag and the blood bag. So I think that covers all the MCQs. And what you see here, you have the yellow bag, red bag. This is the transparent bucket, white, and this is the blue cardboard box. And when it comes to COVID isolation ward, same is the guideline that we are following. Okay, whatever we have been putting in normal hospital, same we are putting here even in COVID hospital. Plastics go to red. Okay, those RPT, same thing. Okay, I don't want to repeat. Then what is the difference? Difference is only that instead of one bag, you are using double bags. I don't know whether you can read this. Double layers of bags are used, or else I will write it. Double layers of bags are used. Instead of one red bag, you keep 2 red bags in the bucket. And daily, you have to disinfect these bags with 1% sodium hypochlorite. That means bleaching powder. You are spraying 1% sodium hypochlorite. That is a point. Okay. And in isolation facility, I think you might have seen the same slide that I had shown for NEET. Red bag, in isolation facility, you are putting goggles, plastic, then face shield, splash proof apron, plastic coverall, all these things goes to red. And the mask N95, which is made of cloth. I mean, N95 is not made of cloth, cloth mask and such things. Your normal mask, surgical mask, everything goes to yellow. Triple layer mask N95, head cover, cap, shoe cover, tissues, all those will go to yellow bag. Okay. Next question. A teacher taught steps of hand washing. Students learned and repeated at home. What domain of learning does it fall under? We have discussed this in class. Do you remember? See, this is a very simple question. My first question is, what do you mean by learning? For example, a child is going to school, and from school the teacher is teaching the child how to wash hand or how to brush teeth. Now, what is the objective of this learning? Is it only to give knowledge, or is there something beyond that? That is my question. See, after attaining this proper knowledge, child should be able to do it repeatedly, and finally the child should be able to make it part of his behavior, right? That is the main objective of learning. So, let us see what is learning. It is a process of acquiring knowledge, skill, values, attitudes and a desirable behavior. So, the final objective, or I would say the final end product of a good learning is to bring about a desirable behavioral change, right? Behavioral change. So, after learning hand washing, the child should be able to do it properly, as well as the child should be able to apply it in the correct situation and make it part of his or her behavior. Now, coming to the question, MCQ. You know, based on the domain that is affected when you are learning something or whatever it is, we have mainly 3 types of learning, or learning is divided into 3 types based on the domain that is affected when you are learning. So, that brings you to the next question, which are the domains that are affected when you are learning? It is affecting your brain, of course, then heart and then your hands. Okay. How is it affecting your brain? It is giving you the proper knowledge and it is helping you to think, and you call it as cognitive type of learning. That means it is giving you the right kind of knowledge, and cognition means thinking. So, that will help you to think. Next is it is affecting your heart. That means it is giving you the right type of attitude. Okay, and this is very, very important when it comes to our medical practice. You know, those emotions which are very appropriate when you are treating the patient, that should come from your heart. Okay, empathy, sympathy, such emotion should come from your heart. So, that is also something that you are acquiring as part of your learning, which is affecting your heart. And the third is it is affecting your hand, giving you the right type of skill, and it is known as psychomotor domain. So, which are the 3 types of learning? One is cognitive learning, then you have the affective learning, and you have the psychomotor learning. Okay. So, hand washing is coming under, that means the child, hand washing means the main objective is the child should be able to do it properly. So, it is coming under psychomotor domain. Is it clear? Okay. This child learned and repeated at home. That means it is coming under psychomotor. Hope you are with me. Okay. Question number 13. Quality assessment for health related program. What type of evaluation does clinical management in a health service belong to? There is a confusion in recollecting this question. Some said this was the question. Few other students told me B was the question. Most effective method to evaluate clinical management done in health center as part of national program is, anyway, the question was regarding the clinical management is coming under which part of evaluation. That was the question anyway. Okay, I don't know which among this was the correct question. There is a confusion. The question is, of course, about the part in evaluation under which the clinical management is coming, whether it is coming under output or input or process or impact. So, let us see what is evaluation first. Okay. What is evaluation? See, whenever there is a program, the question was about national program, right? In any program, when you start something, you always have some objectives, right? Your intention is that at the end, it should achieve so and so objectives. And when do you do evaluation? Evaluation is done at the end of the program. And at the end of the program, you want to know, or at the end of your planning, you want to know whether you could achieve all those set objectives, right? Exam, putting exam, or your NEET entrance is also an example for evaluation. Okay. So, that is evaluation. At the end of your planning, you want to know whether you could achieve the set objectives. That is evaluation. Now, let us see what are the steps in evaluation. This also is an MCQ. Step 1. Suppose you are going to evaluate, say, a private hospital or a government PHC. The first step is you have to, somebody is sending you, okay, you go to that new hospital, there is a new hospital opened up, just go and evaluate. see how is it running. Then the question is, the first question that comes to your mind is, or the first step that you have to set is, determine what is to be evaluated. Okay, what am I going to evaluate there? Okay, am I going to evaluate the structure, or am I going to evaluate the doctors working there, or am I going to evaluate something else? Okay, is it IP or OP? So many things are there in a hospital. So what am I exactly going to evaluate? That should be there in your mind. Second, you establish a standard or criteria. Always you need something to compare, right? Then only you can say, okay, compared to this standard, they are below standard. For that, you need to have a standard or criteria. So you see, after determining, okay, this is the thing that I am going to evaluate, you set the standards and criteria. Okay, we have, when it comes to hospital, we have so many IPHS standards, so many things are there. So whatever it is, you find what is the standard or criteria. Next, plan the methodology. Okay, that is set. Now you see how you are going to evaluate. Plan the methodology to be applied. Are you just going to stand there and watch whether things are going right, or are you going to interview the patients and doctors, or are you going to participate, like media people are doing? You just fake as one of the patient and you try to see how things are working out. So there are many methodologies. So you set which is the methodology that you are going to apply for evaluation. After that, go there, gather information, then analyze the result. Okay, sixth step is take action. If you see that they are below standard, you tell them, okay, this is not the way you have to do, this is a standard, you have to do it, you have to improve it. So you tell them. If it is good, again you tell them, okay, that also should be conveyed, okay, you are doing it perfect, just do like this, never go below what you have said. So like that you can tell them. Okay, and then suppose they are below standard and you have asked them to improve, then what is the next thing? You have to see whether they have done it, right? So you re-evaluate. That means you go through the same steps once again. Okay, so it's like a cycle, I would say. Are you with me? So these are the steps in evaluation. Very simple. Okay, nothing to mug up. When you just think logically, everything will come to your mind automatically. Okay, now the question was regarding clinical management, and the question is from the first step, determine what is to be evaluated. Now let's see. What is to be evaluated is again coming under three headings. You can evaluate, suppose, just think about the hospital only. You can evaluate the structure of the hospital, right? What else you can evaluate? Second, you can evaluate the process. That means how things are happening, how the hospital is functioning. Structure means you have a, IP is there, OP is there, then OP ticket counter is there, pharmacy is there. So these are the various structures which you can evaluate. Process means how exactly is it functioning. Process means structure would be there, but nothing will be working. So you want to know whether it is really functioning or not. That is coming under process. That means functioning. And third is evaluation of outcome. That means everything is functioning, but you want to know whether you are getting the desirable outcome. Okay, that means the results and benefits. So these are the three things when you are determining what is to be evaluated. It should be like whether you are evaluating the structure, where you are evaluating the process, or whether you are evaluating the result. Are you with me? Very simple. Evaluation structure we have already seen, whether you are evaluating the facility or the equipments, the manpower, organization. Okay, that means infrastructure means it's the building as well as the people who are working there. We call it as resources. Okay, material resources, manpower, all these are coming under the structure. Next, how is it functioning? So you have a proper OP, you have a proper IP, pharmacy is there, everything is there, but whether it is doing its function. Okay, that is coming under evaluation of process. That means in a hospital, what are the functions that should be perfectly going? Disease identification, whether that is being done properly. Diagnostic procedures, whether they are functioning properly. Clinical management, there are a lot of doctors, but they are simply sitting, or or they don't have enough knowledge to do the clinical management. So that also should be looked into, right? Whether clinical management is done correctly, whether care and prevention of diseases are done correctly. So clinical management is coming under evaluation of process, right? It's not the structure, but how the doctors are giving The clinical care is coming under whether the hospital is functioning properly. So it is coming under evaluation of process. Process means function. Can we add one more MCQ? Effective and systematic way of evaluating physician's performance is known as how good a physician or a doctor is working or doing his job is known as, you might have heard about this, medical audit. People come to the hospital to do medical audit. They take all the cases, they see a lot of things. It is known as medical auditing. Okay. And the evaluation of outcome means, okay, everything is good, structure is there are enough doctors and they are functioning very well, but what about the result? Is there any good result? And evaluation outcome is given under outcome components are 5 Ds of AI, which is again an MCQ. Which are the 5 Ds that you see as an outcome in a hospital setting. These 5 Ds are whether disease is reduced, discomfort of the people, dissatisfaction, disability, and death. So these are the outcomes that we are looking for when you are evaluating. Okay, evaluation of outcome includes disease, discomfort, dissatisfaction, disability, and death. 5 Ds. Are you with me? So what is the answer here? It is process. So clinical management is coming under the functioning, whether doctors are functioning, how good are they in their clinical management. So that is coming under process. I hope it is clear. I know all these terms would be new for many, but when you think logically, it's very simple. Very simple. Next question is from occupational health. Benzene exposure causes which occupational malignancy? So the question is about occupational cancers. By the way, which are the main occupational cancers? You see. First is skin cancer. Why I said first is this is the most commonly seen occupational cancer. But this is an MCQ. You know, more than 75% of occupational cancers are skin cancers because skin is the organ that is exposed to everything outside, right? So the chance of getting malignancy is also more. So more than 75% of occupational cancers are skin cancers. Now let's see which are the risk factors. Coal tar exposure, X-ray, certain oils, minerals and dyes, all these can cause skin cancers. Moving on to the next, lung cancer. Now what are the exposures which can give lung cancer? Asbestos, many are there, nickel, chromium, uranium, coal tar, arsenic, beryllium, isopropyl oil, cigarette smoking and air pollution. Now don't bother to learn everything, but I will tell you which are the ones that you should be concerned of. Asbestos is important. It can cause lung cancer. We have learned it in many places. Next is smoking, humans and air pollution. The rest I don't think are that important. Moving on to next. CA bladder. The most commonly seen are transitional cell carcinoma or urothelial cell carcinoma. You know that, right? And the exposure which can lead to CA bladder are exposures from aniline industry, rubber, gas, electrical cable industry, and exposure to chemicals like beta-naphthalene, benzidine, para-amino diphenyl, aramine, and magenta. These are colors and chemicals. Okay. And the MCQ, most important MCQ from this is beta-naphthalene. This was the previous MCQ. Okay. And aniline industry. I haven't seen questions from others. So just remember, CA bladder means beta-naphthalene and aniline industry. And the last is leukemia. So leukemia is caused by benzol and X-rays. And benzol contains benzene and toluene. And here, benzol is important, which contains benzene and toluene. So what is the answer? Leukemia. Are you with me? Okay, so benzene exposure causes which occupational malignancy? Leukemia. Most commonly seen is skin cancer, which is not here in this particular option. And CA bladder, I told you, urothelial or transition. Okay, One more MCQ. Which is the most common risk factor for CA bladder? Most common is tobacco exposure. Tobacco exposure is the most common risk factor for CA bladder. Okay, so that covers all the MCQs. The instrument used nowadays to measure slow velocity of air rather than cooling power of air is. Unfortunately, I think many students got this wrong, but in my class I had clearly said this while we were discussing air pollution, the chapter air pollution. So what is the answer here? The answer is cathethermometer. Now what is cathethermometer? Let's see. You see cathethermometer? I'll show you the picture. It looks somewhat like, it's a normal thermometer only, but instead of mercury we have alcohol. And it is mainly used to measure cooling power of air. Okay, it's mainly originally used for measuring cooling power of air. So that brings you to the next question, what is cooling power of air? What is the cooling power of air? Just imagine that you are standing by the side of a sea. Okay, or you are on a sea shore. And when wind blows, what do you feel? You feel very cool, right? No, you feel chilled. And that chilling or that cooling power is more during the evening time than during the morning or in the afternoon, right? So, my question is, what are the three parameters or three factors which determine the cooling power of air? One is temperature. Second is air humidity, and when air moves only you feel that cooling power, right? Okay, so these are the three factors which determine cooling power of air, which is again an MCQ. Okay, and it is measured using kata, as we already know. And there are two types of kata. One is dry kata and the next is wet kata. Dry kata reading of more than 6 and wet kata reading of more than 20 are considered as zones of thermal comfort. They are considered as zones of thermal comfort. That is also a previous MCQ. Okay. Next, kata thermometer is nowadays used to measure low air velocity. This is given in your book. Okay, kata thermometer is nowadays used to measure low air velocity, and we have discussed it in the class. So I have a question. Originally, for measuring air velocity, which is the instrument that we use? Air means anemo. In Greek, it is anemo. So, does that ring any bell? It is anemometer. Okay, anemometer is the instrument used to measure air velocity as such. Okay, so what you see here is anemometer, and what we use now is cup anemometer, which will rotate, and below this top there is a meter that is attached to this, which will help you to measure the wind velocity or air velocity. Okay, direction is by wind vane, you know that, right? South, north, wind vane is there, so that will give you the direction of the wind, which I think you know, I don't have to tell you. Question number 16. Which is a vaccine given for a 10-year-old child in school program? You know this very well. It is TT or TD. This is the answer. See, is it TT or TD? Actually, now we are giving TD only. In programs, we have only TD. TT has been completely replaced by TD. That also we have mentioned in the class. By the way, what is this B? P is tetanus, and small d is not capital D, but small d. Small d is adult diphtheria content. It is adult diphtheria. Because nowadays we are seeing an age shift in diphtheria. Earlier, diphtheria was seen only in small children, but now we see a age shift too. So, what we do is, along with T, that opportunity we are using to immunize for diphtheria as well, so that you will get an extended immunity. That is TD. Okay, if TD and TT were there in the option, luckily I heard this is how you got the option. I'm not sure. If both were there, then you should go for TD only, because now we don't give TT anymore in program. TT is available outside, but as part of program we are not giving TT now, instead TD. Okay, so TD is the one that we are giving in the age group 10. By the way, when will you give this TD? From 10 years onwards, then 15 years. Okay, so 5 years there we are giving it. Okay, what about the MMR? When do you give MMR? It's not actually MMR, but what we have in program is MR, which is given at MR1, 9th completed month, right? 9th completed month, and MR2 at 1.5 years. That means from 16 months to. Now, what about pentavalent? Penta means 5. Okay, you know which are those 5. And pentavalent is given on 6, 10, 14 weeks, right? Okay, up to 1 year only you are supposed to give pentavalent. Beyond 1 year, as per the program, you are giving DPT. That means pentavalent can be given only up to 1 year. So the point that I want to put across is, if an unimmunized child is coming at the age of say 1.5, don't give pentavalent. Instead you start with DPT. That is the point that I want to convey. Hope you are with me. Now what about JE? JE can be considered just like MR. Okay, JE, MR. 2 alphabet. Okay. So JE is Japanese encephalitis, which is given along with MR1 and MR2. So along with that you are giving JE1 and JE2. 9 months and 1.5 years. Okay. So at 10 years what we give is TB. Okay. Moving on to question number 17. On a day of post-Diwali in Delhi, the Central Pollution Control Board has measured air pollutants like carbon monoxide, carbon dioxide, sulfur dioxide, etc. and they got a total of around 470. Which category of pollution is it? So, here again the question is from air pollution. A lot of questions came from nutrition and environment this time. So let's see what is air quality index. So using these things, when you combine, what you get is air quality index. Okay, and let's see how this air quality index are categorized. Here the answer is C. What is air quality index? Which are known as AQI. So it is a yardstick which runs from 0 to 500. 0 means no air pollution. Absolutely nothing. 500 means 500 and that is the maximum. Okay. 5 major air pollutants are included in Clean Air Act, which are ground level ozone. That means air quality index is based on parameters of 5 air pollutants which are ground level ozone. Not the ozone that you see in this chart here. It is ground level ozone. Particle pollution. That means particulate matter 2.5 and 10, that is the size in microns, okay, of particulate matter, carbon monoxide, sulfur dioxide and nitrogen dioxide. So these are the 5 major pollutants that we consider. And how are they classified? Like this. 0 to 50 means good, not good air pollution, air is good. 51 to 100, satisfactory, but we are not very happy, okay. 100 to 200, moderate air pollution. 200 to 300, poor air quality. 300 to 400, very poor. And 400 and beyond is severe air pollution. Okay. And health-wise, good means minimal impact on health. Satisfactory means minor breathing discomfort to sensitive people. It's minor. Moderate, breathing discomfort to people with lungs, asthma and heart diseases. I don't think they will ask from this, but anyway, for completion's sake, let's not miss anything. Be on the safer side always. Poor means breathing discomfort to most people on prolonged exposure. Very poor means respiratory illness on prolonged exposure, and severe means affect healthy people and seriously impacts those with existing diseases. Okay. So that is new in air quality index. Something happened very recently in 2021. What is it? There is a amendment in air quality index. That means they have lowered still lower the concentration of these parameters. We have seen there are 5 parameters and they have reduced the concentration to even low. That means the criteria has been set to a lower grade from what was there till 2020. Okay, so what happened is now the air pollution is much more compared to the previous criteria. Now the criteria has really come down. Now let's see. What we were practicing was the one that was set in the year 2005. What we have now is 2021, which came in September 2021. So what you need to remember is, I don't think these numbers are important, but in WHO site I have seen that they are repeatedly mentioning about PM 2.5, that means particulate matter 2.5 and particulate matter 10. So I think that you can remember. From 10 it has been reduced to 5, from 20 this has been reduced to 15. Okay, and 24-hour value, from 25 this has been reduced to 15, and from 50 it has come down to 45, and the rest I don't think. They just mentioned the rest, but these two they have, that is PM 2.5 and PM 10, they have been repeatedly mentioning in many pages. So I think you can remember, if possible, these values for us to do. Okay, next question. Malnutrition is a man-made disaster and has many ecological factors playing a role. Which of the following ecological factor has a conditioning effect? And many students got this wrong because we were not expecting this question. Anyway, let's see what is the answer. So, you know what is malnutrition? And ecological means outside factors, or a lot of factors which are pertaining in the environment has a role in malnutrition, and you call them as ecological factors, outside factors. Now let's see how these ecological factors are categorized. Ecological factors in malnutrition are categorized as conditioning influence. That was the question. Cultural influences, think in those terms. You have conditioning influences, you have cultural influences which can affect your nutrition, socio-economic factors, food production of a country, and health and other services which are prevailing in a country. So these are the 5 ecological factors which can affect nutritional status or which can lead to malnutrition. So let's start with the first one, conditioning influences. What do you mean by that? As the name indicates, conditioning means certain things which condition or which sensitize your body for malnutrition. What is that? Infections. Okay. So conditioning influences are infections. See, when infection like malaria or measles is happening, especially in a child, what happens? That will lead to malnutrition. Right? That will lead to malnutrition. Moreover, whatever was there, all the nutrition will be lost, and that will precipitate further infection. Okay, that means the infection will lead to malnutrition, and that malnutrition will again lead to infection. So it's like a vicious cycle. So once you get infection, that means that is conditioning your body for further malnutrition, because it is going like a vicious cycle. Okay, whether it is malaria or measles or ARI, whatever it is, all these are conditioning influences which condition your body for further malnutrition. Hope you are with me. Okay. Then cultural influences. I think I don't need to tell you what are these cultural influences. Like food habits. Okay, certain people don't eat, certain food. Okay. Vegetarians, we have non-vegetarians, we have a lot of culture, food habits. So I don't have to go into those details. Like then customs. In certain places, women are given less food, or women eat last. So all this can lead to malnutrition or affect nutrition. The beliefs, food fat, like I said, vegans, the keto diet, cooking practices. In some places they have, I won't say some places, in many places they have the habit of draining water after cooking rice. So that is also not a good habit. Timing will be lost, a lot of nutrients will be, vitamin D, a lot of things will be lost along with that. Then child rearing practices, like some people they don't give colostrum to child, then so many miscellaneous things. So all these are cultural influences which can again lead to malnutrition. So that is a second ecological factor which can cause malnutrition. First is conditioning, second is culture. Then socio-economic factor. Poverty, ignorance, illiteracy, lack of sanitation, which is coming under socio-economic factor. Because if they don't have money, they don't have education, that can lead to malnutrition. Food production of a country. This is what you see in underdeveloped countries or developing countries. We learned about GHI, Global Hunger Index. So we know that it is more in countries like Africa, then Afghanistan. So those are the places. So naturally food production in those countries are less, and that will in turn lead to malnutrition. Health and other services like nutritional surveillance. India, we have this in a good place. Like we have, nutrition surveillance is good. Then growth charts are there. Through our Anganwadis, you are giving nutritional supplements. So those are the things that you should consider under health and other services. In rehabilitation, have they told you? When there is severe malnutrition, the child will be sent to nutritional rehabilitation center. Then nutritional supplements, health education. So these are the factors coming under health and other services. So the point is, ecological factors in malnutrition are mainly divided into 5. We have conditioning with influences under which you are getting infections, then cultural, socio-economic, food production of the country, and health and other services. So what is the answer? Under conditioning effect, we have infections. Okay. Question number 20. A researcher wants to know whether there is an association of CRP values, risk of MI or cancer. They started to take CRP values, C-reactive protein readings. 4 values of RR were plotted: 0.5, 1.5, 1.7, 1.8, and the options were CRP increases disease or cancer risk, CRP has no relation, CRP decreases, and disease decreases, no association in the first together. To be very honest, I really don't know whether this is the question, and my honest thinking is that this question is wrong. Students couldn't recollect the exact question because for this particular question there is no answer. Okay? Now I'll tell you what all should be considered. Here the question is regarding RR. Something is wrong with this question. I couldn't collect, or the students couldn't recall the complete question. If you know about the question, you can just send it to me in my Telegram group. See, the question is regarding RR. That is, what is RR? RR is relative risk. Right? It is relative risk. And what is relative risk? Relative risk is something that you get in a follow-up or study where you are trying to find out the relationship between an exposure and an outcome. We know that already. Here the exposure is C-reactive protein. And the outcome, some said it was MI, some said it was cancer, some even told me it was pregnancy. I don't know how come this much of a confusion. Anyway, some outcome was there, it was MI or cancer or pregnancy, I don't know, some disease. For the time being, I'm going to consider it as MI. And they have given some values of relative risk. So, it seems they have plotted in different situations. Really, I'm not getting what the question was. Okay. Now, what do you mean by relative risk of 0.5? Or, as you all know, relative risk less than 1 means this exposure is a protective factor. It's a protective factor, right? It is a protective factor. Relative risk more than 1 means this is a risk factor, right? Now, look at this. We have 3 CRP readings and we have 3 RR values corresponding to this. The first says 0.5. Now, what is your interpretation? CRP is a protective factor. And look at the last 3. It is more than 1. That means it is a risk factor. So, the confusion is, we can't interpret anything from this question. Some key point would have been there which we have missed. If this was the real question, then I would say CRP has no relation. Why? Because at some points it is showing as a protective factor, at some other points it is showing as a risk factor. That means there is really no association. You can't say that it is a risk factor or protective factor. That means it has no relation. At times it will show as a protective factor, at times it will show as a risk factor. That means there is no relation at all. Okay, so that would be the answer which I will opt if this had been the question. I really don't think this had been the question. Question would have been something else. Anyway, CRP increases the cancer risk. You can't say exactly because we have a 0.5 here. CRP has no relation to B. CRP decreases and disease decreases. No, because three values are showing that it is increasing. No association in the first interval. In the first interval, there is an association, and that association is saying it as protective relation, right? It is showing that there is a protective association. So, the only answer that fits most appropriately would be B. Okay? Next question. There is an outbreak of encephalitis in school children due to lack of proper childhood vaccination. According to the universal immunization schedule, which is the following type and route of vaccination that could have prevented this? So, there is an outbreak of encephalitis, and which is the vaccine that you give in national immunization schedules for preventing encephalitis? It is JE, right? That is Japanese encephalitis. So, encephalitis means definitely it is Japanese encephalitis. So, there is an outbreak of Japanese encephalitis in school. Which is the following type and route of vaccine could have been prevented this? So, the question is about the type and route of JE vaccination. So, the type is JE vaccine is a live vaccine and the route is subcutaneous. And the schedule we have already seen. JE1 at 9th month and JE2 at 1.5 years. So let's see a few MCQs from JE caused by Felix mosquito, right? There are three stages for JE or Japanese encephalitis. A prodromal stage before it causes encephalitis. Then an encephalitis stage marked by CNS symptomatology and a late stage noticed by recovery or persistence of signs of CNS. So there are three stages. Prodromal encephalitis stage and a recovery stage or a persistence of signs and symptoms. Vaccine is live attenuated vaccine, which is a cell culture derived based on the strain is important. SA1442 strain of JE virus, and the schedule is JE1 and after 9 month completion up to 12 months and JE2 from 16 to 20 months. So we have already discussed. And it is given as 0.5 ml subcutaneously in left arm. Which are the vaccines that you give in left arm? BCG and JE. These are the vaccines that you give on right arm. You remember, I've told you, MRI. That way you can remember. R is right. So, measles or MR and IPV you give on the right arm. Okay? So, these are also MCQs. Question number 22. A 54-year-old man from Chhattisgarh is having progressive motor paresis and leg stiffness. What history will you inquire for making a diagnosis? A person from Chhattisgarh, progressive motor paresis and leg stiffening. Stiffening means spastic paralysis, right? Spastic paralysis. Seen in lathyrism. It is seen in lathyrism. And when it comes to lathyrism is mainly because of some problem with the diet. So, what history should you be asking in this person? About the diet history. What do you eat? That is a question that you have to ask. So, the answer is diet history. There is no vaccination, right? Fever, past history of similar illness. So, nothing fits there. The answer is diet history. So, what is lathyrism? As you know, it is
spastic paraplegia affecting the lower limbs. So patient will have to use stick to walk. So 1 stick stage is there, 2 stick stage is there, we'll see. So these are patients with plethysm, neuroplethysm. Caused by, what you see here is dal. Okay. So which dal? Kesari dal is the culprit here. And the toxic principle is BUA, beta oxalate aminoalanine, or BUA. And diet having 30% of kesari dal, if taken for around 2 to 6 months, will result in neurolepharism. Okay, so you don't have to eat it for a long time. If you eat a diet which has got around 30% of this kesari dal for around 2 months, it can lead to neurolepharism. Now 4 stages, there are 4 stages. First one is no stick stage. That means the person has just started his paralysis, so he can walk with jerky steps. That means even without stick he can walk, but he will be very unstable while walking. After that, what happens? Well, as a spasm progress, he may need a stick. So that is known as 1 stick stage, where walks with cross legs with a tendency to walk on toes. After that, what happens is, even with 1 stick you won't be able to manage. Then you need 2 sticks. So that is known as 2 stick stage, where excessive bending of knees happen and the legs become really crossed. After that, what happens? The patient will completely fall on the floor, and then even with 2 sticks, the patient won't be able to walk. So what happens is, he'll start crawling. That is known as crawler stage. Like posture will be lost. Okay, become impossible as the knees cannot support the body weight, and atrophy of thighs and leg muscles happen, and the patient is reduced to crawling by throwing his weight on the hands. I'll show you the picture. See, this is the 1 stick stage, this is 2 stick stage, and this is the crawler stage. See, this is the crawler stage, and the patient, there is complete spastic paralysis, leg is completely atrophied, and the patient is using his hands, see, hands for walking. So, or crawling, I would say. So that is crawler stage, the last stage. Now the question is, can you prevent it? Is there any intervention? Of course, this is preventive medicine, so how do you do it? Vitamin C prophylaxis for more than a week is said to have a good effect. Around 500 to 1000 milligrams of ascorbic acid is said to have a good effect in preventing this. Next, banning crop. Not that easy. Sometimes that could be the only thing they have to use. The thing that could be available to you. You can't, if they are from a lower socioeconomic strata, then banning the crop won't be of a practical solution. Then what? Let the crop be there, but we try to remove BUA, that is toxic, by 2 methods. One is heating method, means soaking in hot water for 2 hours and then using it after drying, or parboiling, soaking in lime water overnight, drying it and using it. So this is said to have a good effect that will remove the toxin, and educating the people not to eat it. Okay, may help, but we can't be very sure. Genetic approach. Strains with lower level of toxin still under research. Socioeconomic changes. Of course, that can be done, but do you think it is happening? Not that easy. So, these are the interventions, and there the answer was diet history. Next question, number 23. The Anganwadi teacher takes weight and height of a 4-year-old child and finds out that height for range is less than 2 standard deviation, likely causes. By the way, what do you mean by less than 2 standard deviation? I've told you, that means below normal. That means less. Up to minus 2 standard deviation is normal. Below that is less. Here, what is less? Height for age is less. Height less means what? Chronic malnutrition, right? So it is chronic malnutrition. Here the answer is chronic malnutrition. Now let's see. We already discussed this, but for confusion sake, low weight for height is acute malnutrition. And the child looks somewhat like this. That means weight is okay or normal, but very slim. And we call such children as wasted, right? Oh, nutritional wasting or emaciation. Oh, yes, you're so emaciated. Okay, that is the first thing that you tell someone when you see a very thin person. And it is a sign of acute malnutrition. Second is low height for age. This was the question. It is stunting or dwarfing, which is seen in chronic malnutrition, like this. And low weight for age is, that means age is normal, weight is less. That is underweight, which is common for both acute and chronic malnutrition. So this entirety is common. Underweight is common for both acute and chronic. And you call it as underweight, low weight for age. So here the answer is chronic malnutrition. So I guess we have gone through all the major MCQs which came for the previous NEET exam on September 11. And if you have any more questions in your stock, please let me know. And I hope we could, or you could get a lot more other MCQs in and around these questions that we have discussed. So thank you very much for your patient listening. Bye.